Our next session is titled Coping with Loss and Grief. And I think some folks think that loss and grief can only occur after the physical or the tangible loss of something or someone. But the truth is that many of our life changes that happen in life can actually bring about unexpected feelings of loss and grief. And people caring for someone with a brain tumor often experience multiple losses along the way, starting the very day of diagnosis. It's important to understand that you too might be having some of these feelings. And by recognizing your emotions and gaining acceptance of some of these changes that you're experiencing, one can actually navigate life's transitions with a greater sense of ease and resilience. So today, we're going to talk a little bit about that. And we will share some tools that you can use to help you manage some of these feelings around change, loss, and grief. Our speaker today is Dr. Sue Morris. She's a clinical psychologist and the director of bereavement services at the Dana-Farber Cancer Institute in Boston, Massachusetts. She's also an assistant professor in psychiatry at the Harvard Medical School. Please welcome Dr. Sue Morris.
Thanks, Margareta, and thank you all for having me here today. I will, cover quite a bit of information and have the slides that I'll just now move along. Oops. Okay, you should be able to see that now. I just have a disclosure just to acknowledge there about some self-help books that I receive royalties for. So I just wanted to start a little bit about what Margareta was talking about, was thinking about the experience of caregivers when their loved one has been diagnosed with a brain tumor. So as Margareta said, I'm a psychologist and work a lot in bereavement, but we know so much about what happens during someone's diagnosis certainly can impact bereavement if that is what happens. But for caregivers, when someone you love is diagnosed with a brain tumor, there are many adjustments you have to make. And these can be, small and large, and they can range from, changes with your own family situation, getting children to school, getting to medical appointments, and also, of course, your work. So there's just a lot, and that can be, certainly overwhelming. And depending on how ill your loved one is, the degree your life changes, and that's going to vary over time. And it'll also vary depending on their needs. And this kind of often is referred to like a roller coaster, which I'm sure many of you have used that term. But I think, again, from a psychological perspective, really developing a kind of a toolbox of strategies. So if you could imagine a kind of an imaginary toolbox here, that you're going to put different tools in that you'll use at different times. These tools can help you cope and navigate this uncertain time. And some tools will be practical tools, getting help from other people, things like that, but also how you talk about, think about what you're experiencing and how you cope. And so I'm a big believer in helping people have a sense of what to expect, because this is an uncertain time. And if you can have a sense of, what might be coming ahead, it helps you feel a little bit more in control. And, as the topic is today, we're talking about seeing this as kind of a grief reaction. A lot of this is a grief reaction. And I've just put a very simple diagram here that when we think about grief, it isn't just related to the death of somebody, it's related to, different losses. So that loss or the losses triggers change. And we always want to think about change within a grief reaction. So just kind of holding those two concepts in your mind for a moment. Just to kind of give you a little bit more kind of background about what actually is grief. And, grief is a word that we use pretty commonly in our society, but it's a normal response to loss. Even though it can be very painful, we have to think of it as a normal response to loss that tends to follow a wave-like pattern. So in the beginning, the waves of grief can be very kind of intense, not much downtime in between, and often, you know, the waves may settle at times. When we think about it from that kind of psychological perspective, you know, grief is defined as the anguish experienced after significant loss. Typically, the death of a loved one is how we commonly refer to grief, but also, as Margareta was talking about in the introduction, in relation to, you know, another significant life event, such as being diagnosed with a serious illness. People also have grief reactions in response to maybe the breakup of a relationship or losing their job. So it's kind of a term that relates to loss. The reason I like this term, this definition, is anguish. I think anguish is a really useful word, and unfortunately our English language doesn't have a lot of words that describe the depth of people's grief reactions, but anguish kind of gets to the heart of that kind of mental suffering and, you know, physical suffering to some extent that people can experience. But often there's a tormented quality. People are often second guessing themselves. They feel quite distressed. And so I think it's useful to try to kind of be able to name that this is the response. So when we think about grief, it's characterized obviously by deep sadness and then this yearning or longing. And it's the yearning or longing that really gets to what grief is. In relation to, you know, someone being diagnosed with an illness, or yourself, if that's in your case, it's usually longing for the way things used to be. You want to be back in that life you were prior to that diagnosis. And if it's following grief following the death of a loved one, it's kind of yearning to be with that person again, yearning to see them and to hold them and to have your life back. So it's really, you know, this yearning or longing, and we tend to feel it. It's got a physical feel to it as well as something we're thinking about. Grief is usually seen as a very emotional reaction. You know, most people think about grief as something we experience emotionally, but we also experience grief physically. And I think that gets underplayed and minimized. And especially for caregivers, you know, you're probably, even to the lead up to the diagnosis of your loved one, you may already be dealing with a lot of change already. And you often come to that with some kind of physical and often emotional exhaustion. So just being wary that there is a physical component to grief as well. And we would say it involves a period of adjustment responding to change. There's a lot of change that people experience, as we said, on all different levels. And, you know, as I mentioned in the beginning, is one of the hardest things I think for people is not knowing what to expect. You know, if you've never experienced this before, and I'm sure for many people that this is maybe the first time, it's really hard to know what to expect. And that feeling can be anxiety provoking. So when we think about the grief reaction following the diagnosis of a serious illness, we want to think about the diagnosis as what we call in kind of the health professional kind of world as a major life event that presents a crisis for the patient and family. And this kind of crisis, if you want to think about it as a meaning, it's kind of intense difficulty and it's trouble. Your world's turned upside down, and there can be a lot of fear initially, and this grief reaction that I'm talking about, this sadness, and then an uncertainty, and it all kind of gets mixed in together. Life is disrupted as everyone has to adjust to change routines and medical treatments. And that's going to depend on whoever's kind of physically in the home, but also, you know, other people around, as well as obviously for the patient themselves. Psychological or emotional support, I would argue, is essential to help both the patient and their caregivers adjust to the many changes they face. Because I think in all aspects of life, when we've got a lot of change that we're facing, even if it's, you know, change we do expect, it can be kind of nerve-wracking. And then I would argue and suggest very strongly that following the death of a loved one, and this is for every, you know, in all cases when somebody you love dies in your life, bereavement support is usually very important. And that can include, you know, finding out information about what to expect, whether what I'm experiencing is kind of normal and expected. And for some people, they're going to want individual and even maybe group support. Because, you know, grief at any level, whether it's, you know, when somebody has been diagnosed with an illness or maybe after somebody has died, grief can be very isolating, and we need to kind of think about how do we help support people. So this is just a simple kind of representation of some of these major components that I've already talked about. So when a diagnosis first happens, it kind of triggers a lot of responses. And it's not linear, and it's not meaning that everyone's going to have all of these in the same kind of way as someone else in their family, but just to think that it's usually kind of this diagnosis, not knowing what it means, what's going to mean in the future, causes a lot of uncertainty. And with uncertainty can come stress and fear. You know, there's the stress of the physical and emotional kind of changes that you have to go through to help support somebody, as well as feeling kind of afraid. And all of that feels very kind of disconcerting. And on top of that, then, as we've talked about, is then change. There's this kind of ripple out effect to lots and lots of different changes. And then this kind of grief response that sometimes hangs a little bit in the background, very, very kind of sad, uncertain, wondering about the future. And as you can see, like on the right-hand side there, I've put in purple control. I think control is something that kind of undermines all of this. People often feel out of control when their loved one has been diagnosed. Certainly the patient themselves may feel kind of that they've lost a sense of control. And kind of going through that treatment trajectory, you know, you're looking kind of to help kind of get guidance about how to increase your sense of control, because that is what kind of adds to all of these kind of responses of feeling afraid, uncertain, is not knowing kind of how to get your life into some sense of kind of control. So we want to think now then kind of from this kind of what we're thinking about in our kind of in our brains. And often, you know, we think about this at night time, and, you know, being kind of lying awake at night, you might have things that are concerning you. So it's helpful to think about what to expect, because again, if we can think about what to expect, and even though it's not going to be this case for everybody, there's no one way, but if you think a little bit about it, it can help you identify ways that you may take action to feel a little bit more in control. So as I mentioned, we think about that roller coaster of the illness. I think, you know, when people talk about the roller coaster, we all can have that image in our head of a real life roller coaster or a diagram of a roller coaster. But most people use it as a common kind of way of describing that up and down kind of experience. And depending upon the diagnosis and the treatment, patients and their caregivers kind of begin a roller coaster consisting of many ups and downs that for some can last, you know, months or even years. You know, initially, you know, you may have hope for a cure. Things may be going well and things are holding steady. There may be a trial, there may be a different treatment. So this kind of roller coaster has this effect. Sometimes it goes kind of down fast and then it kind of goes up again. And I think it just kind of creates this kind of image that kind of impacts that experience, and kind of grief is following with that to some extent, and that uncertainty and that fear. But initially, as I said, you may have hope for a cure, you know, you're going to get that information, but these hopes may change over time depending on the progression of the disease and the patient's kind of, or your loved one's response to treatment. And this period of time on this roller coaster, especially early on, can be particularly stressful. Especially those, you know, who have got little support. And, you know, you may be doing this kind of solo. And also for parents of pediatric age patients, and if you have other children that you have to take care of, or other people in your life you have to take care of. So it can be a very stressful, both emotionally and physically, a physical time. This is kind of my attempt at a very simple roller coaster, but it's just to give an image. And, you know, you can see on that kind of y-axis, there's the stress that you may be feeling. And usually, you know, at the period of initial diagnosis, that stress is really high. And then as you meet with, or your loved one meets with the medical team, and if you're involved in that, you're getting some kind of plan, some kind of information, that stress level may go down a little bit. Then there may be some kind of test results, for example, and that may cause that kind of stress to go up again. So I think it's just to highlight that this is a very individualized kind of response, and you probably could draw your own one yourself, but depending on where your loved one is and where you're at in the roller coaster, it's going to change. It's going to change over time. So just to kind of have that sense that it is that very much related to kind of stress and distress. So I now just kind of want to talk a little bit about anticipatory grief. And, you know, Margareta mentioned this at the beginning, that anticipatory grief really refers to the distress or, you know, grief response a person might experience before the death of a loved one, or, you know, in anticipation of a different kind of loss, you know, maybe as someone loses more of their functioning. But for caregivers in particularly, anticipatory grief usually includes, you know, both the sadness associated with the physical and cognitive changes in their loved one, and the sadness associated with missing their old life with their person. So, you know, if it's your partner, for example, who has a brain tumor, you may be missing some of the old life that you shared together as a couple. Obviously, if it's you're a parent and your child has a brain tumor, there may be, you know, certainly different aspects that you're missing that you were doing before the diagnosis, whether it's with friends or family or just the life that you had together. And depending then where you are on this roller coaster, there can be many losses that you might experience. And I think Sandy mentioned some of this in the previous presentation. Often people around you, if you do have a support system or friends and family who are checking in on you, very well-meaning, but often these losses are not well understood by other people. You know, they're not seeing your day-to-day life. They're not noticing those little changes that you may be very much acutely aware of. And so, you know, people only when they check in on you just see a snapshot of your life. Whereas that's kind of why I think, or one of the reasons why it's really important to be able to be your best advocate for what you need. And I know when I meet a lot of people, you know, some people they don't want to ask other people for help. They're not somebody who does that. They want to do it all on their own. But I think it's really important to be open to the fact that this can be a very stressful physically and emotional time. And having other people who can help is really important. So this slide kind of just separates some of those losses, and there's many more, but just to give you an idea, some of those anticipatory losses or the losses that people are you know, going through on a day-to-day basis for both the patient or your loved one and for you, the caregiver. So if I just kind of focus a little bit first on for the patient, you know, there can be some of these, you know, they vary, but physical functioning, and, you know, obviously depending on how much someone's physical functioning is impacted by their brain tumor, their sense of independence is a big kind of loss. There can be cognitive kind of decline, you know, maybe their memory is impacted, or, you know, maybe their language, things like that. Emotional functioning, you know, it's not uncommon for people to talk about how their loved ones, you know, personality change. So maybe the patient's personality is having, you know, some different kind of changes that you're aware of. For the patient, their identity might change as well, especially if, say, they've been working and now they can no longer work, and their sense of identity now, you know, has definitely been impacted. There can be those changed roles personally as well as in their professional lives. Kind of their history that they had shared with somebody, and then also their future. So there can be many different losses. And then on the other side for the caregiver, you know, again, depending, this is, you know, just a sample, but your relationship with your loved one can change, and it may change slowly, and there can be a shift. You know, if you're a partner, for example, or a spouse, that may change, that relationship may change then more into a role as a caregiver. As again I mentioned, there may be some changes in their personality, which changes the way you interact. Your relationships with others, maybe the shared friendships you've had. Maybe if you're a couple and you're used to going out with a, you know, a couple group or a friendship group, some of those relationships change when maybe you can't enjoy those activities in the same way or not participate in the same way. So friendships can change. Your friendship may change as a caregiver because you now may be very much focused so much more of your time on caring for your loved one that you can no longer kind of interact with your friends in the same way that you may have, because you just don't have the time or even the emotional kind of bandwidth. As we talked a little bit about at the beginning, daily routines change. There's going to be constant adjustments to your day-to-day life, whether it's at home and work, if you're working, your sense of autonomy and independence, and your sense of control as well. You may only be able to leave the home for very short periods of time. So all of those things change. Again, as I mentioned before, shared interests and activities. Your future plans. You may have been planning things for retirement or the future. Those things may change. And then, obviously there's the possible death of your loved one. And that, presents a different kind of loss with also and many, many different losses. And I'm sure each of you could add to this and have experienced your own, but it's just important to be able to name some of these losses, because to some extent, just at least acknowledging them can be very, very helpful. So then I just kind of want to switch now then to kind of what helps, because, that's a question and a very important question, and it will again vary for people. But I think it's helpful to imagine this imaginary toolbox that's sitting here, which is going to have a mixture of information, accurate information, guidance, helping you guide by people who have either been that way before, been in the kind of your shoes before, the medical kind of guidance, and then as well as support. And the support, we want to kind of break it into that emotional support as well as physical support. So there's the little icon, just so you can remember, like a toolbox is a really important thing, because the strategies you use or the tools you use will vary. What you may need today as a tool may be very different to what you need some months down the track. So just being mindful that the tools vary, and some will be more helpful to you than others, depending on your own kind of unique circumstances. But the tools, can include information, as I said, guidance, support, and then psychological tools or skills. Again, thinking some of it may be how I think about what I'm experiencing. So I'm going to break those down into the different categories. So first of all, information, and I think some of this you had in Sandy's presentation. But you want to seek out accurate information about your loved one's diagnosis, their treatment, and their prognosis, if you choose to want to know about that. And, I always encourage people to check in with their medical team to find out kind of reputable places to find accurate information. Because I think we all know that for anything, you can go down that kind of internet rabbit hole that can take you into the wrong place. So you really want accurate information. You want to understand the symptoms and the way the tumour might impact your loved one's cognitive, emotional, and physical functioning. So different kind of impacts there. And then you want to learn about how best to care for them. It may not necessarily be now, but even further down the track. Again, it's getting kind of familiar with what to expect. But learn how to best care for them, which kind of includes activities of daily living, such as, bathing and, meals, all of those things, hygiene, and then managing their medications and medical care. We certainly know that can be a huge task for people because it's very complicated. And then finding out about kind of other resources within your community, whether it's, financial assistance, whatever else is open to you wherever you live. And then developing some kind of system. It doesn't have to be fancy, but some kind of system to track appointments and bills, and especially within that insurance kind of bureaucracy, because we know how overwhelming that can be, especially if you're not familiar with doing these kind of tasks. So I think some people use online systems, some people use a good old kind of diary or a book, but just having a system, a filing system, I think can really help. Again, it's about increasing your sense of control. And then the second category then is kind of falls into this guidance and support. And what do we mean? I think, everyone can get a sense of that, but what are some of those examples of what is guidance and support? Support, again, physical and emotional, I think are two essential kind of tools in the toolbox. Meet your loved one's medical team. Consider speaking with an oncology social worker. I know Sandy mentioned that. And I would encourage people, even if you don't think I need that, I would encourage people to ask to meet your oncology social worker very early on. And it may be with your loved one as well, because you may not need it now, but it's then if you've already established a relationship and they know you, you're in the system, that can be very helpful if, down the track, one of those, that roller coaster hits a rough patch. You may then just want to reach out on your own even to ask some information. And if you've already met them, it makes it easier to have that connection. Then consider joining a caregiver support group. I think that's been spoken about before. There's just so much you can gain from a support group. I know it's a time factor and people often have to, find the time to go to a group. Hopefully if it's online, that gives people a little bit more flexibility. This can be when, maybe a friend or a neighbor or somebody's offering to help. They can come in and help with your loved one whilst you are attending a caregiver support group. So you can kind of function, kind of hone in on it without having to worry. Explore options to use professional caregivers and home health aides. I think there's, an array of that, and that's been talked a little bit about before, to give you some kind of additional support. And then asking family and friends to help. Again, it can be hard and you may not necessarily have a big support group, which gets to finding out about other resources or volunteers in the community. But if you do have family and friends who are offering, many people will say, "Oh, call me if you need anything." And that's, that's well-meaning, but it's a little hard because most caregivers aren't going to quite go, "Oh, I'm going to call now that person and ask exactly for help." When somebody says, "Call me if you need anything," I would be practiced and maybe have a response that says, "That would be really, really great. Would you please, consider calling me on, Monday next week? And I'll, ask you to come by," or something. Like, be very specific with a request. And if you feel that I'm not someone who likes to do that, I want to do it on my own, I think sometimes if people offer to help and then you don't kind of engage their help, that they'll stop asking because they think that, they're burdening you or they don't want to hassle you. So just to be a little bit mindful of, if people do offer, I would accept that, especially if there's somebody you trust and have a good relationship with. And then, at some point in that roller coaster, you may have to consider some respite options, of which your team would be able to provide or to give you ideas about. And then, checking in with your local doctor. We know, in all kinds of serious illness, caregivers often push their own needs to the back burner. And I think, just again, in the same way as checking in with an oncology social worker early on, just letting your local doctor know what you're going through, because then if you've got any of your own medical needs, they can be on top of that. And then some of the psychological tools, and these ones, sometimes you may need some assistance with these, but they often fall into, what we think, how we think, our expectations, our belief system. But the first one is maintaining realistic expectations about your loved one's progress. Again, checking in with the team, just having an idea of where your loved one is at on that roller coaster and what they can or can't do. Because often it's, things can change quickly, and having a sense of that can help you. Aim to do some different things in your life to increase your sense of control. I'm a big believer in helping people think through running daily to-do lists. You've probably got many, many things to do, and they will kind of vary depending on whether it's related to the care of your loved one, the running of your home, maybe if you've got children, what their needs are, or other children, or if you're caregiving for somebody else, or your work. You can break up these kind of roles that you have into different categories, and then run a list. Because often when there's so much information, we get overloaded, and part of our worry is that we think we'll forget something. So if you have a to-do list, then the idea is to list them all, and in fairly small kind of chunks, things that you can easily check off. And then you may say, look, I've got, 10 things I would like to do today, but prioritize them. What are the top 2 that you need to do? And then do them as early as you can so you can check them off. Again, it helps you feel like, in control. I've achieved something today. But then part of that realistic expectation is that you've also got to build in flexibility to your day, because you're not quite sure what's going to also happen. We also know if you've got to call doctors or providers or insurance companies, everything at the moment takes a very long time. So to be able to buffer in that to your schedule. Building that support team, we've mentioned already, but for yourself as well as for your loved one. Consider a counsellor for yourself, in addition to the oncology social worker. This would be particularly relevant if you've had maybe a counsellor in the past, or if you've had a history of depression. You want to have somebody kind of who's on your team. And it may be someone I just check in with monthly, and it may be on Zoom, which can also, again, help because it helps with flexibility and scheduling. But just to already have somebody booked in, if that's what you think you would find helpful. And then if things get harder, you can maybe see that person more regularly. And then find ways to pay attention to your own self-care. Self-care is a big umbrella term, and I think one of the biggest things we hear is that people don't have time to look after their self-care or their own self, or prioritize their self-care. So you want to try and do little chunks. As I said, see your local doctor. Again, it may just be a phone call. Let them know what's happening. Keep up with your medical appointments to the best that you can, and your dental appointments. I think I see a lot of people who push all those to the side, and then it kind of causes more problems down the track. Creative outlets, even if it's only something you can do in your home at night time. Journaling, I think, the more you can write down what's in your head, it helps that kind of worry cycle. And then exercise, even if it's just, someone's popping in for 30 minutes, I'm going to quickly go for a walk outside for 20 minutes. Just exercise, even exercise in your own home. Lots of really helpful things on YouTube these days, or different apps that can help you do kind of exercise in your own home. Then kind of just including then the kind of being aware of your feelings and your thoughts. It goes back to that idea that, caregiving can be very lonely and isolating, even if you've got people around you. So kind of try to be aware of when you notice that you're becoming more distressed. Maybe the distress is you're becoming more sad, or, you're becoming kind of more withdrawn. Try to kind of notice when maybe it kind of goes up. It's like a scale. It may get higher and higher on that scale. Make a plan for when it gets to the point that it feels that you can't, some of the tools you've been using aren't kind of helping. Making a plan to kind of manage the distress or tackle it if it feels particularly big. And that can be kind of leaning on friends, asking for help, checking in with some of those kind of medical health professionals. And then checking your thinking. I mean, we don't often spend a lot of time on this, and I think we all have this self-talk that goes around in our head, and sometimes it's not helpful. If, for example, your loved one's personality has changed, or has changed a little bit, maybe they're a little short with you or a little angry with you, trying not to take things personally, being able to say, look, I know it's not themselves, it's more the disease speaking. So trying not to take things personally, even though that can be hard. And that can be where kind of talking in a support group can be helpful, because you're probably not alone. And then, as we've talked about already, advocating for yourself, practicing this as a tip, as a strategy, asking for help. And sometimes there are kind of those anonymous phone lines, as well as, people in your own support system. And then, just to kind of start to wrap up, I think professional help, a lot of people, wonder when is it that I should be seeking professional help. As I said, I do believe getting kind of support early on, even if you don't use it very often, can be helpful. But definitely seek professional help if you feel particularly stuck, as though things are getting worse, or you're experiencing kind of distressing emotions such as anger or increasing frustration, you're feeling really depressed. As I said, especially if you've had a history of depression that predates your loved one's diagnosis, if you're feeling hopeless about the future, if you're having, difficulty eating or sleeping. I mean, sometimes you may be having kind of trouble sleeping because you may need to get up in the nighttime to support your loved one. But if that's persistent and you're not, really paying attention to yourself, you're not getting time to have that shower in the morning, whatever that is, and if you're feeling really overwhelmed with caregiving responsibilities. I know there's a range, so I think you've got to work out when is it that these feelings stay for too long or they feel too intense, not to feel that it's kind of any kind of weakness to seek professional help. We strongly believe that no one should have to worry alone, because this is a very stressful time for the patient, the loved one, as well as yourself. So really holding on to that, that's kind of a mantra, if you want to think of it as that, is that no one should have to worry alone. So I'm going to kind of finish there. I think I'm just about on time, or maybe a little bit earlier. That's the disclaimer that went up before. And I think I will just kind of say thank you, and thank you again for having me. And this is something I think we could talk about for a long, long time, and that everyone's situation is difficult, is difficult and different, but just to really think about your kind of toolbox, thinking about generating or developing your own personalized toolbox. So let me just finish there, and I know that I'll turn it back to Ambreen, I think.
Great. Thank you so much, Sue, for your wonderful presentation. Just as a reminder, if you have questions that you want to ask, please type and submit it using the Q&A button, and we will answer questions as time allows. All right. So one of the first questions we have here is asking about coping with loss of self and identity. We talked about your changing role as a caregiver and all the losses that go with it. Can you talk a little bit about how to cope with that type of loss, the type of loss where you no longer really understand who you are?
Yeah, and Amber, just to clarify, is that coming from the caregiver's perspective?
Yes, coming from the
Yes.
caregiver perspective. Yep.
Yes. I think that is a hard one, right? Because your identity changes, and that follows probably that wave-like pattern. And it really is about, I think talking that through with somebody can be very helpful. Maybe writing it down. If you could imagine, one exercise I've used with people is like a pie graph, like a round circle, and you cut the pie into different slices. And maybe I was, my job, or my part, being a partner or being a parent or a friend, and some pieces of the pie change in size. And so really looking at maybe what has shrunk, often it's, things change and that caregiving role takes a bigger slice of the pie, but really then focusing on what can I do in the other aspects. Continuing to maybe be that friend. Maybe I can't be the friend in the same way that I was to somebody, but I can be that friend in a smaller way. But identity, that gets back to the anticipatory grief, right? It's very much that your identity is kind of fluid, it changes, and some of it you kind of have to grieve for this point in time.
Thank you so much. You also brought up the importance of identifying and tuning in with your emotions. Can you talk a little bit more about how to identify when you're experiencing grief? I think that can be difficult for some people. What are some things that we should look for, maybe physically or emotionally, to be able to recognize, okay, now we need help?
Yeah, that's a good question. I think sometimes, again, I can't generalize to everybody, but often those physical kind of grief, tears may be one of the first things that, someone notices. You have this, even privately, especially if you've been holding it in. Often people don't want to let their loved one, that who is the patient, see them. So maybe when they go to the bathroom or have a private, in their room for a minute, that kind of can be that overwhelming sense of loss, and people often cry. So crying can be a good indicator. It's not a bad thing, it's just to be aware that feeling of sadness. I think grief, again, it goes back to that anguish that I talked about. You're feeling, it's kind of hard to describe. Again, I said in the presentation that our English language is really strapped for words. Am I really sad, a little bit sad, deeply sad? We don't really have a lot of words to describe it, but I think getting into, you usually feel it somewhere in your body. So trying to maybe pause for a moment and say, what is it that I'm feeling? We often notice our feelings, and they can be on a scale. If you want to think of it a little bit like a pain scale or a barometer or some kind, you may have 0, you're not feeling any particular emotion, and 10 might be the maximum. So say I'm feeling really sad. Sad may be 10 out of 10 and 0 is not sad. Well, I might notice that today I'm feeling a 5 out of 10 sad. And maybe it's because I've thought about some of those losses that I'm either anticipating or experiencing, even just physically seeing your loved one, maybe the changes they're going through. But it does change. I think it's not to think of grief as just a one-off thing. It's got different facets to it depending on what the person is going through. But that's where having a friend, even a friend, I think some of us can have friends who can be empathic, but some friends may be like, you can't think like that. So you want friends who can allow you to tolerate your sadness, which is why I think a counselor or a support group can be a really good avenue.
Thank you so much for sharing that. And I want to verbalize a tip that one of our attendees shared here, thinking about that toolbox and the importance of just creating a quiet space for yourself. And it could be a space that you share with someone. And I think that kind of goes into exactly what you were saying, is giving yourself and allowing yourself that time and space to feel those emotions and to feel and recognize, acknowledge that grief.
Yeah, and it's probably not a very professional kind of statement, but I always say to people, whether it's in bereavement or in illness kind of related grief is better out than in, right? It goes back to that, no one should have to worry alone. For most of us, most people, we feel better when we can share something we're worried about with somebody else who we trust. And I think that's when, most people will say, I feel better after a good cry, or I feel better that I just talked to my person, some other person who's supporting me, who I trust.
Thank you so much for sharing that. Now, we have a question regarding professional support and finding the right form of professional support. You had mentioned there's the oncology social worker that you can talk to, a counselor, a therapist. Can you touch on how to find the right type of professional support for you? What are credentials they should look into? Who can they ask for recommendations or referrals?
Yes, yeah, that's good, and it's a hard question, right? Regardless of whoever's going for counselling in any kind of problem area or issue, I would start again with the oncology social worker. Usually, an oncology social worker, depending on what the setup is, may be giving you resources. It may not necessarily be that you're going all the time to see them, but they, within your local geographical area, they may have a list of people who they commonly refer to. You'd be looking generally, if you don't have that, you'd be looking, your primary care doctor, your physician may also be able to have a list. But you'd be looking for people who deal in kind of illness, grief, adjustment to life's transitions. Some people on some of the online kind of websites that have like a referral base, or even through insurance, you can put in the type of issue why you would be seeking counselling. And I would be looking for illness, adjustment to, the transitions in life. Most likely people will probably be a licensed social worker, a psychologist. Some people may see a psychiatrist if they feel they want medication, who also does some kind of therapy or support, a licensed mental health counsellor. I'm in Massachusetts, so that's going to be a little different. So depending on your states, they would be the kind of the main categories I would be going through. Often asking people, if you go to a support group at the facility where you're at, sometimes other people who are already in the group will also have an idea of who may be a good counsellor. These days, a lot of it is online, so you can kind of even go further in your state depending on where the person's licensed. So the geographical, unless you want to be seen in person, that may give you a few more options. And a lot of people will also give you a 15-minute, 10-minute conversation, like, why are you coming? Let's talk a little bit about it to see whether we think we could be a good fit. And also going to your insurance company, as I said, as well.
Great. Thank you so much for that guidance. We have another attendee here who shared a great tool that was helpful for them, a guided journal that they just bought online. Can you talk a little bit about journaling if someone wants to get into journaling as a tool? What are some prompts maybe they can follow to help get them into that?
Yeah, I know that one, it sounds interesting. I'm not sure if it would have prompts, but I think big picture, whether people who journal for any kind of anything in their life that they're grappling with, or even not, maybe they want to keep a story of their life, but for people who are kind of grappling with some kind of hard issues, I think why journaling, and we know there's kind of some good data out there on this, it takes more brain power to put your thoughts down on paper than just to think through them. So if you have to write down, gee, what am I, what's happened today? What am I feeling? What's that kind of, that pain, or that, what's my scale of my grief today even? It kind of makes you order your thoughts. And there's something, I think, very, it's kind of like, if I get it out like at 3 o'clock in the afternoon in my journal, maybe it's not going to keep me awake at night when I'm trying to go to sleep, because it's something about getting it out on paper. I think it also can help you track your progress. If you date your journals, date your entries, you can see, gee, well, I was thinking this a month ago. I'm actually not thinking this today. Sometimes it can be helpful to say, these are the things I'm worried about. These are the things that I need to focus on. What's my to-do list? You can even include your to-do list in your journal. Maybe plan, what I part of my identity, some of that that pie I was talking about. Who can help me? What do I need to do for the next week? Making a plan, or even writing about what's happening with your loved one during that period of time.
Thank you. I think that's some great guidance for anyone who might be interested in trying to start journaling or trying it out and seeing if it works for them. I think we'll take just one last question, and this one goes back to that communication piece and having someone that you can talk to about what you're experiencing. What advice can you share for caregivers in sharing those emotions, the feelings of grief and loss that they may be experiencing with their loved one who is the patient? How do you navigate those conversations, because it can be important for them to understand, but it can also be a tricky tightrope to walk when you're sharing emotions with someone who is sick.
Right. And that's, of course, going to depend on the relationship. It's also going to depend on where on that roller coaster people are, and the loved one's kind of cognitive emotional functioning, whether their personality's been impacted. I think it's probably helpful to say something that's fairly specific and factual, but maybe it's trying to have that wider supportive communication with somebody else. Because if the person who, I'm just using the word patient to make it easier to say, if the patient is maybe the person who was always your sounding board, and now they can't take that in, then that's a way you've got to change now your expectation. I can't expect them to support me or listen to me in the same way that they would have. So I need to find someone else to be my sounding board. But maybe I can be very factual about, I'm very tired. I'm going to go and put my feet up on the couch for 5 minutes, or we're on this roller coaster together. There's some language that maybe you can use to talk, but I think it's really about adjusting your expectations as where you can get what you can get back from them. And that's a hard question. I think that one's going to be also that it's going to change over time. What you communicate early on may be very different towards the end, and some of that may be what you write in your journal. What I would say if I could.
That's great. Thank you so much for your thoughtful answers, Sue, and for your wonderful presentation. That is all the time that we have, and I'll go ahead and turn it back to Emily. Thanks again.
Thank you.
Yes, thank you so much, Sue, for sharing with us on such an important but yet sensitive topic of adapting to change, loss, and grief.